I'm not used to using a microphone, so just let me know if I'm too loud. So, as Suzanne said, I'm Jean. I work at the Cancer Center with Suzanne, and I've been a social worker since 1980 was when I got my master's degree from Boston College. And I started out working in mental health, and then I kind of worked in, transferred over once, it was after a move, and my kids are small, I started working in medical, and it was always my chief interest anyway. And I was working in a home care program that I pretty much developed in New Hampshire for 18 years. And then I moved to Indiana, and I was working in a non-hospice palliative care program called Life's Journey. And then I transferred over to the Cancer Center about a year ago. But when I was working in medicine, I would say probably about a third of the people I worked with had cancer when I was working in home care. And the Life's Journey program was a lot of in home care with people with more advanced cancer. So now I'm over at the Cancer Center, and I really do love what I do. And it's a little bit different than what I've done before, but a lot of it is the same. So what I'll tell you is most of what I've learned is from my patients. And I think that if just listening to people and seeing the strength in people and having the ability and just listening to what they tell me about how to manage things and really listening to them has taught me more than anything that I'll ever learn anywhere else. And I think over the years, having been doing this for so many years, that's really helped me to figure out how to work with people, and has just enhanced it because it's the people that I've worked with, the people that I've had the opportunity to serve have really taught me. And I think that everybody has been touched by cancer. I can't imagine that anybody hasn't lost someone or had someone in their family that's fighting the illness. In my life, there were 3 people. I lost my dad when he was 62. He got sick at 59 with cancer. And then my sister, who's a year older than me, had cancer in her mid-40s and was successfully treated. She had advanced cancer, and her son was a freshman in high school, her youngest, and he's now out of law school. He's 30. So, and then my son-in-law, who I didn't know when he was 12, had childhood lymphoma and is a cancer survivor. So 2 out of 3, I would say, are cancer survivors, and I think that's pretty good, and I think it says a lot about cancer can be a chronic illness. So when you're working in a cancer center, you see people at every stage. I want to talk a little bit about that there's different things that I think when I talked to Jean Butler, we were talking about how we can help people who are dealing with cancer, and I think there's a lot of factors, and one of the ones that I want to mention is it depends on what people need may depend on the kind of cancer they have. While there's similarities in what people are coping with all cancers, some of the ones I just want to mention is that lung cancer can be particularly challenging, and I think one of the psychological issues for people with lung cancer, if they smoked, is a lot of self-blame, and it complicates things. And of course, everybody can look back and have done a million things different, and but a lot of people want an explanation. So that can create a little bit different challenge. And then I think people with glioblastomas and brain cancers, it's really hard for the caregivers. That probably is what I found, is that the caregivers struggle the most because that often the person can develop some confusion at times. And then I think like with the head and neck cancers, people can be disfigured, so that can present some other particularly challenging issues. So there's a lot of factors that you look at when you're thinking of how to support people with cancer, and I'm just mentioning 3 that stand out. And then of course, how advanced is the cancer, whether it's early stage or whether it's advanced stage cancer. And then a huge one that I deal with a lot is the socioeconomic status of people. Money is a huge factor for anybody that's impacted by cancer. Most people lose income and have expenses for treatment, and I'll talk a little bit more about that a little bit later. And then I think another big factor that is important is what kind of a support system a person has. So if a person has a really big support system, that's a huge help to somebody who's, for a person and their family that are trying to deal with cancer. And so I always am checking in on people's support systems, and you can't assume that people do anymore. I mean, I'm here, and with the exception of my husband, my entire family is thousands of miles away. So, you know, for me, if I were sick, that would present a huge dynamic. And so I'd have to look to other areas of support. So I think that, you know, it's very important. But there have even been studies that shown people with good support systems and a lot of support do better. And then I think another factor in terms of dealing with people with cancer is their own personal history in terms of what kinds of things they've had to deal with previously, and that people who have had really difficult, traumatic lives in dealing with cancer brings a lot of this up. And then, of course, there's the people's spirituality has a huge impact on how they cope and deal with cancer. So those are just some of the things that I'll touch on. But I guess one of the things I wanted to start with is the basics. Is first of all, when somebody's diagnosed with cancer, I would say they're in shock and they're petrified, and there's no other way about it. And so everybody who usually walks through the door, and I'm seeing people early on with these distress screenings, even if they say they're not, they're usually pretty frightened by it all. And so they're going to be anxious. And so it's, in terms of thinking about what to say to them, I think it's important just to think about that first, because if the whole idea is to help all of you be able to support people that you know or people in your congregation that have cancer. And so I think I'll start with that it's absolutely normal to feel uneasy. You may feel uneasy when you hear that somebody was diagnosed with cancer and that they're struggling. And that's okay. You don't have to be comfortable with that. You don't have to feel okay about it, but it may affect how you talk to them or what you say to them. Sometimes people, when they're nervous, have a habit of saying the wrong thing. So I think recognizing your uneasiness is important. But there are some things not to say. And the first one that I think of is to say, I know how it feels. I don't know how it feels, and most people don't know how it feels. There may be some people who know how it feels because they've been there, and that's a whole different thing to say, I know how it feels. Or to at least let them know, you may not know exactly how they feel, but you may have some idea how they feel. So never, ever, just assume that, just tell people you know how it feels, because they'll just see right through that. And they'll say, well, how could they know what I feel? They haven't been here. And so you can say, I can only imagine, or something like that, but you haven't been there. Don't give people false optimism. If you hear that somebody has really advanced cancer, don't just go out and say, I know you're going to be fine, and I know everything's going to be okay, because it might not be, and they may then feel that you're not being genuine. One thing is, don't comment when people look bad. They know they do. I mean, they'll look in the mirror. You can comment when they look good, because when they're having a good day, but a lot of people, they hear a lot about how they look, and they're self-conscious to begin with, and they already know it. Don't share stories of family members and what happened to them with cancer, particularly if they died. And I hear a lot of that when people come in. Sometimes, they've been diagnosed maybe in the last week, or sometimes just a day or two heard that they had cancer before I've met them. And some friend or family member will have shared a story about somebody who died. And that's just devastating, particularly since many people, so much of cancer is a chronic illness and people are cured. But everybody associates it with death, and so they hear the C word. So I think that's really important, not to let people know that, not to say things about people who have died. And don't offer advice. And if you do offer advice, don't be insulted if people don't take it. A lot of people don't want advice, and so people feel like it's well-intended, but it's really not the time to offer advice. Things to say, and I'm sure you all have things that you have said that's worked, and I've heard a lot of things from my patients that have worked, but if you're uneasy, say something like, I'm not sure what to say, I just want you to know that I care. So acknowledging that you're not sure what to say. I'm sorry to hear you're going through this. How are you doing? If you would like to talk about it, I'm here. Give people permission not to talk about it. Sometimes when people have cancer, that's all, that becomes everything consumes. So you want to acknowledge it, but they want their normal life and they want to be able to talk about other things too. Please let me know how I can help. I'll keep you in my thoughts. Can I pray for you? And maybe if you're in a church, in a congregation, in a family, you can just say, I will pray for you. But in other situations, you might have to ask, can I pray for you? Humor, if you have somebody that's got a sense of humor, that's great. And again, talking about other things that they like. I think the most important thing in communication, of course, is listening, and I think we all know that. I think it's probably, once years ago, I was doing a presentation when I was in my home care in New Hampshire for staff, and we were talking about, I think at that point, there had been a study that said 70% of communication was listening. I'm sure it's much higher than that. But people need to be heard. But on the other hand, people are very proud and independent, and it's really difficult to ask for help. So I think that it's really helpful to give people concrete things that you can do for them and to let them know and to offer very significant things. Sometimes it could be doing an email, like I will offer meals, ride to appointments, respite, so a family member may come out, accompany to treatment, rides to, for somebody to be able to get out and just have the caregiver to have time for themselves. Socioeconomic status is absolutely huge. Cancer affects people financially unbelievably, and I think because I'm now working solely with cancer, I see it even more. When you think about it, when people go on family medical leave, they don't get paid for that, so if they don't have vacation time, then they're not getting paid in the beginning. So that's huge. Many people lose their entire income, and if you've been in your job less than a year or you're in a small company, you may not be protected by family medical leave. So some people lose their entire income. Not everybody has short-term and long-term disability. Most people do, but not everybody does. And when they get to a certain point, often they go on COBRA. COBRA can cost sometimes $1,000, but several $100s a month. So people not only are losing their income, but then they have COBRA for their insurance. I find people sometimes are so worried about money that they can't even focus on their cancer and they're getting better. It's just, that's what's keeping them awake at night. To get Social Security disability, you have to have a prognosis that you're going to be out of work for a year or more, or you're terminal. There are compassionate conditions. It's mostly stage 4 cancers, and they send for all of the records from the cancer center and from other doctors and look at those. For people who do get approved for Social Security disability, there's a 5-month waiting period till they get their first check. So sometimes I'm talking to people and they want to apply for Social Security disability and they think, well, at least I'll have something. They might not have much else. But then I have to give them the bad news that there's 5 months, even if they get approved, that they're going to wait for a check. And that's a long time to not have anything coming in. I don't know. I was once at a workshop, or on an online workshop, and we were trying to figure out why they came up with the 5-month wait. And there just was no rationale for it. And you would think that maybe with some conditions they would make that less. So a lot of people don't even qualify for Social Security disability that have cancer. The good news is that, that's not necessarily a bad thing medically, but for the people who do, even then they have a 5-month waiting period. So if you get short-term disability, usually it's 60% of your income. Some people have 70% because they purchased it, but 40% of your income is a huge amount to lose. It's not unusual at all at some point for people to lose an entire income. And to get health insurance through the marketplace, it can be expensive. There are subsidies, and so some people get that. Medicaid, the actual income limit for one person is $983. And then for a couple, it's around 13 something. So Medicaid is extremely hard to get. For one person, you can have $1,500 in assets. And if you have 2 cars, that's an issue. House isn't usually an issue, but 2 cars can be, they'll be looking at that, unless there's 2 drivers. But if somebody happened to have 2 cars, that could be a problem. Then for HIP, which is the Healthy Indiana Plan, it's like $1,500 or $100 in that area that people can have for an income, which is a little bit more generous. So some people that don't qualify for Medicaid can qualify for that, and I think that was expanded with health care reform, so that more people are eligible for that, which has been a huge help. But still, most people are paying for their insurance or have COBRA, and then the deductibles in this day and age are huge. A lot of people have $6,000 to $10,000 deductibles on their insurance policy. And if you happen to get diagnosed around now, then you have your deductible again January 1st. So I've had people that have had $20,000 in out-of-pocket costs just because of the time of year they were diagnosed right in a row. So that just eats into absolutely everything that they have. So people are devastated financially. It really is. And all the cancer centers, I think, are really trying to help people, and they have a lot of programs. They have financial people who try and get them insurance, and they have people that are looking at all of these things. And another part about disability that I forgot to mention is that people on Social Security disability don't get Medicare until 2 years from when they're disabled. So people say, well, I know I'll have disability and now I'll get Medicare, and they don't get Medicare for 2 years. So they have to get an insurance policy for those 2 years if they don't have one. So there's really a big need for financial assistance, and I think that any organization that has funds that help people with household expenses, basic expenses, while they're dealing with cancer provides a huge service to them. So sometimes we say to people, have you talked to your church? Have you asked your church? And when I do try and get people financial help, which I desperately try and get them, breast cancer is the easiest to get help for because there are a lot of organizations and because of the prevalence. So the most grants that are out there are for breast cancer. And then the others, there are slim pickings, but we can find a few here and there. There's a few through the Leukemia and Lymphoma Society. But most people, they're on a lot of funds out there to help people. So we always recommend that they go to their churches, and the township trustees help people sometimes pay their rent from 1 to 3 months, or might pay their expenses, and then we'll look at energy assistance. And we were always looking at everything that we could possibly come up with to help people just keep a roof over their head and being creative. And I'll give you even examples. SSI, which is not Social Security disability, SSI is income-based, but it is a disability, and it's in the range usually of $700 a month. Some people that have no income and very little money can go on that while they're waiting for their Social Security disability. But if somebody opens up and says, hey, my mother just gave me $2,000, they reduce the amount. So they don't use funds that people get, but they do use, like, if anybody gave them money. So people who are honest sometimes get really stuck in that. So the financial challenges are absolutely enormous for people with cancer. So I would say one way to support people, a big way to support people with cancer, is to have any kind of funds available for people in emergencies to keep a roof over their head. We also do, we have people who help people get medicine and medication assistance people, and that's all they do is help people get their medicine, and that's just a wonderful service. So medicine isn't always a big issue, but the other daily living expenses are huge, and there are times that most hospitals will write off bills. So that's probably one of the bigger areas that people are dealing with. And then I wanted to mention culture. One thing when working with people dealing with people with cancer is to know their culture, and that's really helpful. And different cultures, some cultures don't talk about cancer, and some do, and then some cultures have a lack of trust in medical, so helping to know your culture, the culture of the people that you're working with, can be really helpful. I'll just give it the personal example. When my son-in-law and daughter had their child, his parents took us out for the day and out to lunch, and it was an absolute disaster because I said, because I knew he had had cancer when he was 12, we were talking about raising children, and I said it must have been so hard. They had 4 children. I said it must have been so hard when Patrick was sick. You would have thought I had sworn or something at the table. I mean, the table went dead silent. His father began to cry, and then his mother in the car said, "We don't bring our business out, and we don't talk about our business with anybody else." I was like, oh my God. I mean, I didn't know it was a family secret. I didn't know it was a taboo subject. And I think perhaps in the Irish culture it is, but it was the most uncomfortable rest of the day that I'd ever had. I mean, I was very happy to go back to discussing potatoes or something. It's just give me another subject, because I knew it was very innocent. I was just thinking how complicated it must have been to have 4 kids and have 4 children and then have this child who has cancer, and they're running back and forth from where they live to Dublin. And my daughter had told me all about it, and my son-in-law had told me about, he did a Make-A-Wish trip. He did a Make-A-Wish, so he was pretty sick, and I can understand, but you don't talk about it. I've learned I would never bring it up again. But it was really eye-opening how much I had offended them by bringing that up. I don't look forward to running into them when I go there anymore. I'm like, oh boy, it's just never been the same from bringing that I know that. And so I'm not sure what all that is about. And I would say that, family cultures are important, and people who find it hard to talk about things, or people who are from very closed families, you have to respect respect their cultures. When I went to a seminar where it was mostly social workers, and it was on cultural sensitivity. And one of the African-American women brought up there that, I think it was through Tuskegee, but there were experiments that were done with African-Americans, I forget how many years ago it was, and so the lack of trust in the medical system, and that was why the families brought so many people often to appointments. I never knew that. I mean, I don't know where I've been, but I didn't know that. It was such an eye-opener to me, that the lack of trust. And now a lot of times I hear that, and it's been really helpful to me to have heard that people don't necessarily trust doctors. One woman said to me today, who was having surgery, she said to me, "I think I'm going to bake my surgeon a cake." And I said, "Why are you going to do that?" And she said, "I want him to be happy and do a good job." And I thought, I was thinking, but she was so wanting to trust this doctor with her care. And I had never made any of those connections before, but it would never enter my mind to make my physician a cake before I had surgery to keep him happy. But it was great. I mean, I love her, and it was great. But I said, I don't think you need to do that. I don't think that's going to affect his surgical skills. Culture is really important. As far as the stage of cancer, early cancer, there's no cancer is any less devastating than another, I would say. I think what I find in the age at which a person is diagnosed, when the young people come in, and where I'm only working with adults, it's very, very hard for the young people that come in and have children and small children. So the support also has to go out to the families and people with small children. For people who have more advanced cancer, that is definitely a different kind of challenge, and particularly as the cancer progresses. And I'm sure in your congregation you've lost people to cancer, and it's hard to watch, and it's very painful, and it never gets easier. And what I would say is, as long as I've been listening, and in one of my jobs, I dealt with a lot of people who had they're both basically heart failure, COPD, and cancer, who had more advanced, and so weren't quite hospice, but were kind of pre-hospice. And the discussions are very painful to listen to somebody, and I think that empathy, to think that you can empathize with somebody who's facing their mortality, even though we all know, it's really, really hard. It's very painful to listen to, it's very hard, and they can't be in that space all the time. Their brains won't let them do that, and that's good. People go in and out of denial. But when people need to talk about it, it can be very painful. The other day, I just ran into somebody in the waiting room, and they just looked very upset, and I just said, do you need to talk? And I wanted to bring them to a private place. And they just said to me, I think I'm ready to let nature take its course, and then began to cry. And I just sat with them for a while. There was really nothing I had to offer except maybe to sit with them. But it was hard. It was very painful to listen. And I love this person. I'm very fond of them. And just sitting with those thoughts. And there's probably limits to how much we can empathize, because unless you've been there, you really can't know what they're feeling. So it's just sitting and listening and being with people at that point. You hear a lot about palliative care, and hospice is one kind of palliative care, but there are other kinds of palliative care. Palliative care is really comfort, quality of life, and pain management and symptom management. So when people are talking about that, I think some people are hoping for miracles. And I guess, I want one too. So I'm like, yeah, I want to say yes, I think there will be a miracle. And once I went to a workshop, and what they said was that miracles happen, but they're rare. So just, don't say that nobody's ever going to have a miracle. You don't want to take away their hope, but maybe don't confirm that, yeah, I think you're going to have one, because we don't know. And so it would be nice, but it's not giving up. Some of the things that people think at the end of their life, I've had people who say, I can't stop treatment because that would be suicide. That's not suicide, but they think it is. So that's a great place where clergy come in, and I think to get somebody spiritual to speak with somebody, because spirituality is huge in terms of people's end-of-life decisions. And if you don't agree with somebody's decisions that you're trying to help, it's just respecting them. You don't have to agree with them, but respect, because it's very painful decisions that people have to make, and things that people are going through. People have to make, there's something called the POST, Physician's Order for Scope of Treatment, and it's a place where people can put all their end-of-life wishes down. And sometimes people are doing those, and so it leads to a lot of discussion. But the main thing is to be able to just be with people, and not to feel like you have to fix it, or you have to say something encouraging, or because you don't want to give people false hope and they'll see right through it. But to be with them, and then try, when people won't last in that discussion, they'll move on to something else, and our minds go into denial, and I think that's a good thing. I think denial is a great thing. I think there's times we need that. Things you can do, though, when people are struggling and want to talk, is just ask open-ended questions. Just ask, what do you mean? What do you think is happening? What's going on now? What are you struggling with? And don't always feel like you have to respond. And of course, physical pain is a huge issue, and so that always needs to be addressed, and wanting to know what people's goals are. Reminiscing, respecting privacy, respecting spirituality. I think some people need to talk and some people don't, and whatever they need to do, there's no right or wrong way. So obviously where a person is in terms of their cancer is huge. The other thing that I find is that when people get diagnosed with cancer, they're traumatized, and I always say it's like a PTSD. When people, no matter what kind of cancer they have, most people are so traumatized. They're having flashbacks, they're having dreams, they're anxious, they're not sleeping. If you looked at the symptoms of post-traumatic stress disorder, it's the same thing. So sometimes it depends on who it is, but I will tell them that this is kind of like post-traumatic stress disorder. And think about it, and they'll say, yes, it is like that. I'm having all these feelings, and I'm feeling really helpless. And they're extremely anxious. So anything that can relax people is huge. Anything that people can do that will calm them down and relax is really helpful. One thing that I do is I try, whenever I think people are open to it, I'm always assessing the individual, but I try and teach people the deep diaphragmatic breathing and say, and I've done that with some of the radiation patients who are really afraid of getting on the table or having a mask on or something like that, and just teach them like deep breaths in through their nose, out through their mouth, count to 4. And those things activate the sympathetic nervous system. And so psychology and psychiatry is really understanding much more about anxiety and the brain chemistry, and the brain chemistry really shows that you have the sympathetic nervous system is activated when we're anxious, and it doesn't really matter what it is. Our brain changes, and our brain chemistry is different for a while. So people who are chronically anxious, their brain chemistry will be different. So anything they can do to relax themselves is really, really important. So deep breathing is a huge one, muscle relaxation. I have some flyers for the cancer support community, and that's a wonderful organization. They offer free yoga. Yoga for anxiety is huge. I probably should be in yoga because I'm promoting it so much, and I would like to practice what I preach. I do a little bit of yoga, but I don't get to do it often enough. But it is huge in terms of activating the part of the brain that the parasympathetic nervous system, which calms and relaxes you. So deep breathing, muscle relaxation, yoga, and it doesn't have to be real active yoga. So for cancer patients, most cancer centers are offering yoga. They're offering other things. They're offering deep breathing. They're offering, I probably didn't bring enough for everybody, but it's the cancer support community. It's over on West 71st Street. And then, of course, support groups are offered to help deal with anxiety. But most places have counselors that are available to the patients too. I call myself the jack of all trades and the Johnny on the spot, because I'm there to talk to people as they need, but I usually am not doing the private sessions with them. We have somebody else who does that. And, but the other part about trauma that is really important is that some of the people that come through the door have had very difficult lives, and some of them have had histories of abuse. Some of them have had terrible things happen to them. I have had many war veterans who saw combat who have post-traumatic stress disorder. So you probably have plenty of people in your congregation that might already have trauma and post-traumatic stress disorder. And so when they get diagnosed with cancer, it's like all that trauma can be revived and can come back, and it can be that much worse for them. So just be aware of that that's a time when people feel very helpless, and a lot of people, sometimes it might just be supporting them and getting some extra help for that. And the other thing that I would say is that when people are diagnosed with an illness or have a crisis in their life, we reorganize our thoughts and our priorities. So for many people, very, very positive things, they'll tell me I'm changed forever and I'm a different person. My priorities are different, particularly the people who have finished treatment. And many people are happier, will say I'm happier. And I would say one of my family members who had cancer was a different person after they had cancer. They were actually difficult to deal with. They don't live around here, so I can say it, but they were really, really difficult to deal with. And they just complained. They were the most negative person, and they were just hard to be around. And they changed dramatically. Just priorities changed, began to appreciate their family and life and just see all the good things. And many people do that. We all reorganize our thoughts when we're in a crisis. Everything changes. That's a priority. So many meaningful things happen with people when they're in a crisis. And it's just wonderful to hear and wonderful to see. And I hear that all the time. People will say, I'm a different person now. My life has changed forever. But I just now don't sweat the small stuff. I know what's important. People's spirituality increases. They just can change in so many positive ways. And that's really what all crisis intervention is about, is that people have the opportunity to change. So many people find meaning in illness, and so do their families and caregivers. And I think that brings to the caregivers, because I told Jean brought up that she thought it would be very important to talk about caregivers. And you don't want to ever forget the caregivers when you're working with somebody with cancer. And that is very, very difficult. And I'm sure some of you in the room may have already been there. And so if you want to know what to do for people, and if you want to know how to support the caregivers. What I would say about the glioblastoma caregivers is that some of them are just exhausted. That's what I found, is they're just exhausted, and their life has just been turned upside down really fast, and in many ways, because some of it is like almost like caring for somebody with Alzheimer's and cancer at the same time. And then with some of the people who have children, they're trying to help their children at the same time as they're helping their spouse. So that's a huge issue. But again, concrete help or respite care, offering to go sit with the person so that the caregiver can get out, a phone call of support, meals. And what I'll tell you is that rides to appointments are huge. That is something people can do for people, and that gives sometimes the caregiver a break, but regardless whether they have a caregiver or not, there are programs available, but again, getting back to resources are limited. The American Cancer Society uses volunteers. You have to have a 4 business day notice. So sometimes people's appointments change and they can't get that 4 business day notice. And then they don't always have volunteers, but most of the time they do, and they're wonderful. It's just that it's a 4 business day notice, and that doesn't work for a lot of people. The Little Red Door is another organization. That is a phenomenal organization. They offer so much for people. They give them they'll give people like free nutritional supplements like Ensure and things like that will help financially, and they do a lot. And they also provide transportation, and they only require a 24-hour notice. But there are people who just can't negotiate those things, and some people are just uncomfortable because that's a yellow cab, and the caregiver can go with them. But rides to appointments are such a big thing that people need. Despite those 2 resources, people still fall through the cracks. And so any time that availability for people who need it, and I think if you can do it in a way that people feel like they're not begging or asking, people are more likely to ask, because people are so proud and they don't want to bother other people. So anything like that for caregivers. And the other thing to remember about caregivers is that not everyone's cut out for caregiving. So some people just are not going to be good at it and they can't do it, so don't judge them. Not everybody is born to be a caregiver. There are people who are just lousy at it and are going to need more help, and that's not a judgment on them. We're all different. And I don't know how I'll be at it. I mean, I don't know. Physical care would be difficult for me. I know that. I've done a little bit of it, but it was challenging. And so just understand that not everybody will be able to handle the caregiving, and that it's not necessarily mean that they don't love the person or care just as much as anybody else. And then the last thing I want to mention is that compassion fatigue. And when you're trying to help other people, you can feel their pain sometimes. And so what they say is you can go through secondary trauma just by listening to people and being with them when they're in really painful times. So what I suggest about that is that you think about relaxation for yourself. And one thing that's really suggested, and this is always suggested for people that work in healthcare and in medical professions, is to relax your muscles. So one thing is, particularly if you're Stephen ministers and you're going into some difficult situations, is that I would suggest notice when you're in a tough situation and you're in something that is with somebody and there's something that you're hearing that is very painful, is notice your body. Where do you feel it? You start to notice that, that's huge. Or after you leave, for me it can be my shoulders, and I will feel, if I've just maybe talked to somebody that was very upset and it was a painful thing to listen to, it was a painful discussion, I'll come out and I'm tied in a knot and my shoulders are up, or sometimes my jaw is clenched. And so relax your muscles. Pay attention to that. Again, that changes your brain. It changes your brain chemistry, all those little things. Do some deep breathing afterwards. Do some relaxation. I try and regulate myself over the course of the day by just looking at where my tension is and just, stretching. I mean, I don't do it in the waiting area. I go back to my office and I'll just do a little bit in a private area just because I can feel it. And it wasn't until I did a workshop on compassion fatigue did I actually start to pay attention to that and realize how it was. When I was doing home care, I used to go to bed at night and my fists would be like this. And I used to think, God, my hands are like in a knot. Well, I was driving, after a visit that was difficult. My hands are on the steering wheel like this. So notice all those things. It's normal, it's healthy, you're going to feel people's pain, and just pay attention to yourself too, and then take care of yourself so you'll be a better caregiver. So that's all I have to say, and I'm open to questions and discussion.